Good morning. First of all, our apologies for being a little late starting this morning. Had a few technical issues to iron out. But I want to thank you for joining us today. I'm Shawn Eberly, the Benefits Administrator for the Colorado Department of Transportation. Joining me today is Vanessa Kniff and our outstanding OIT team. Did want to let you know that this will be recorded. It will be available for view later. If you are joining us via virtually, thank you for joining us. If you are here at CDOT headquarters, we encourage you to come on down to the T-Rex room, join us in person. It's always better with a live audience. This is the annual open enrollment benefit webcast, where we're going to give you information on what's changing and also walk you through how to do an open enrollment transaction in Benefit Solver. Little housekeeping, first of all. If you have a question, please don't hesitate to ask, because chances are others have that same question. During the presentation, we do ask that you submit your questions to us via email, which is at dot_benefits@state.co.us. One of us will be monitoring that email and taking any questions that come in. We do ask that you use the subject line, Open Enrollment Questions. Please include what benefit your question is really in relation to, not just, is that new this year? Did that change this year? Let us know which benefit you are asking about, because there may be a little delay between the questions coming in and our having moved on to another part of the presentation. We will answer as many questions as we can during the webcast, unless they are too personal or too detailed in nature. Or if we run out of time, we will respond to all questions via email following the webcast. All right? A couple of resources that you should bookmark or make note of. The first is the Department of Human Resources State of Colorado Employee Benefits. This is a go-to site for all things state benefits, and it includes the 2023-24 Employee Benefit Guide. By the way, I do see that we have the wrong year on there. Nobody needs to point it out. Also, CDOT employees can send your questions and documents to Vanessa and myself at the same DOT_benefits box. Both of us monitor that, and we can get back to you more quickly. And you'll probably only get one response rather than one from both of us if you send it to the shared box rather than us individually. The biggest question we have every year during open enrollment is, what's the company key for Benefit Solver? So I'll tell you here one more time. It is SOC, as in State of Colorado, and that is going to be all small letters. So the 23-24 open enrollment, it started Tuesday, April 11th. It will go through May 1st. So it's already in action, and some of you have already made your changes. Thank you for listening and not waiting till the last minute to do those. What do we need to know about open enrollment this year? Well, a few things. First of all, open enrollment is passive. This means there's nothing you need to do during open enrollment if you're not changing any of your plan elections, if you're not changing who you're covering under your state benefits, if you don't want to change your pre-taxed, post-taxed options, if you are not participating in a dependent care or health care flexible spending account. If you're not doing any of those things, there's nothing you need to do. We do recommend that you still go into Benefit Solver, view your benefits, verify what you have, and make sure you don't want to make any changes. So again, if no changes are being made to your benefits, your current benefits will continue starting July 1st. This is with the exception of flexible spending accounts. Those you do have to re-enroll in every year. But again, it's a good idea to go into Benefit Solver, view what you currently have, make sure it's what you want. One key note here is, if all you want to do is view your benefits, please do not click on Start Open Enrollment when you get to your home page in Benefit Solver. Instead, click to view your benefits summary. That will show you what you currently have and what your costs are, so you can determine if you want to continue with those next year. Okay? So we're going to talk about two things here. One is new hires and open enrollment. If you are a newly hired state employee, CDOT employee, you do have 31 days from your start date to enroll for state benefits. Now, when you do your new hire enrollment, those benefits will only be effective from the first of the month following your start date through June 30th, 2023. If you complete your new hire transaction between April 11th and May 31st, you will also need to do an open enrollment transaction. And this is so that whatever benefit elections you make will continue for the new plan year starting July 1st. Benefit Solver will prompt you after you've done your new hire enrollment to then complete an open enrollment transaction. The second thing we want to talk about are qualifying life events and open enrollment. Qualifying life events include marriage, divorce, birth, death, or if an employee, spouse, or child gains or loses other benefits. Now, if this happens at any time during the year, you're able to make changes to your benefits outside of open enrollment. If it happens during open enrollment, you also have to do an open enrollment transaction. Remember that you have 31 days from the date of that life event to make changes to your benefits in relation to it. And those changes will then be effective the first of the month following the life event. During open enrollment, between April 11th and May 31st, if you have a qualifying life event, you want to first do a life event transaction benefit change in Benefit Solver, and then do an open enrollment transaction so that those changes will continue come July 1st. Remember that open enrollment changes take effect July 1st. You may have a life event, such as a birth of a child or a marriage, that you want the benefits to take effect before July 1st. This is why you need to do two transactions. The first one for the life event, the second one for open enrollment. Okay? And Vanessa's going to holler at me if any questions come in. We do encourage you to go ahead and send those questions to dot_benefits@state.co.us.
We do have one question.
And we have a question.
Can my child, who is a full-time medical student over 26 years old, be under my medical insurance?
Unfortunately, no. The state rules do allow you to cover your legal spouse and legal dependents under the age of 26. That is mandated under the Affordable Care Act. However, once a child does reach the age of 26, they're no longer eligible for coverage under the state benefit plans. But congratulations on having a kid in med school. That's quite an accomplishment. All right? So now we have to get into the bad news, good news. We're going to try and do the bad news first. This is not the part of my job I enjoy. There will be increases in both employee and state premiums for medical and dental insurance plans starting July 1st. You can find these rates on the DPA website, and that would be colorado.gov/DHR or dhr.colorado.gov. I will tell you that those premium increases are about 10%, and they are across the board for all plans, for all tiers, about a 10% increase in employee share of premiums. Know that these state costs are also going up, so it wasn't all passed on to employees. Second change that you need to be aware of is some of the Kaiser plans, all of the Kaiser plans, had changes made to the deductibles and the out-of-pocket maximums for the next plan year. This was done so that the Kaiser plans are more in line with the Cigna plans, so that deductibles across the board are about the same for all of the medical plans, depending upon whether it's Cigna or Kaiser. There will be changes to the Cigna Pharmacy Administrator. It will be changing from OptumRx to MedImpact. This was sort of a late change coming out, so not everything is quite in place, such as a dedicated customer service line, and we don't necessarily have all of the documents ready to provide to employees. This will not have a substantial impact on employees with Cigna insurance, but it may impact some employees. If, in fact, you choose Cigna and then you find that because of the change to MedImpact, you're going to be negatively affected, you will have an opportunity outside of open enrollment to change your plan election because of the change to med impact. So if you have Cigna and you have pharmacy concerns, we will be providing more information on this change to all employees, and those concerns will be addressed on a case-by-case basis as they come up, okay? All of the medical plans will have increased fertility and gender reassignment coverages starting July 1st. There will be no increase in para contributions this year. If you remember the last couple of years, what we contributed to para went up every July 1st. That will not happen this year. The HSA contribution limits are increasing to $38.50 for individuals and $78.50 for family. Also, the rollover amount for healthcare FSAs will be increasing from $570 to $620 starting July 1st. Lastly, those employees that currently have optional employee life insurance will again be able to increase their coverage. If your coverage is less than $150,000, you will be able to do an increase in coverage between $10,000 and $50,000 up to that $150,000 mark with no medical underwriting. That means that your additional increase in coverage cannot be denied because of medical conditions. Okay? We are really going to push this year the Insurance Premium Supplement Program. This is a program that's been around for a lot of years. It actually gets funding from the tobacco industry, and that funding is used to help employees offset the cost of coverage for themselves and their children under the state medical and dental insurance programs. The application window for the Medical Supplement Program started April 11th, and it goes through May 12th. To be eligible for this, you do have to be hired before July 1st, 2023. You have to be enrolled or willing to enroll in one of the state's medical and or dental insurance plans. You have to have dependent children who are enrolled or that you are willing to enroll in a state medical and or dental insurance plan. And you have to have at least one dependent child not covered by CHP Plus. It is based upon household income. Employees do have to apply for this program every year, but for the last several years, those employees who applied and were eligible were actually granted supplements that completely covered the cost of their medical and dental insurance premiums for the entire year. Now, a little confusing when we say you must have children enrolled or be willing to enroll. It may be that when you're doing your open enrollment, you say, wow, I really can't afford to cover my kids under the medical and dental insurance. But if you cover yourself and then you apply for the medical supplement and you are approved, you will have a special enrollment period during which you can add those children to your insurance so that they also have coverage and it's covered by the supplement. Okay? No questions coming in because Vanessa's not jumping up and down over into there in her seat. Family with an I, as I call it. This is something that a lot of information has gone out about in general, and a lot of questions are coming in on, and unfortunately, we don't have all the answers right now. Family with an I is because in November 2020, Colorado voters approved Proposition 118, which created a state-run family and medical leave insurance program, thus the FAMLI, okay? This is, in fact, an insurance program that will cover all Colorado workers, not just state of Colorado employees. Family with an I will be administered by the Colorado Department of Labor and Employment. They will be the division that is taking claims and determining eligibility. The program, the insurance, will provide paid time, and it is a percentage of pay, not 100% of pay, a percentage of pay for employees unable to work due to their own or family member's medical condition. The premiums for this family with an I insurance are paid by both employees and employers. It is not optional. If an employer has opted into the program, employees are required to pay the premiums. Now, for state employees, it was initially communicated that the state of Colorado would be covering the full premiums for 2023. That is, from January 1, 23, when premiums started being paid, through December 31st, 2023. However, there has been a change, and now the state will be covering those premiums, the employee share premiums, until June 30th, 2023. Starting July 1st, state of Colorado employees will start seeing a deduction on their paychecks for that insurance premium, and it is 0.45% of your earnings. So we're talking about 45 cents on $100, okay? Participation is mandatory, it's not optional. Employees will be eligible to begin filing claims and receiving paid benefits January 1, 2014. And as far as administration and coordination of Family with an Eye at CDOT, that will fall under CDOT benefits. Now, at this time, the state of Colorado has not yet determined how Family with an Eye will interact or impact current leave options and job protections available to us as state employees, such as sick leave, annual leave, family medical leave, paid family medical leave, workers' compensation, disability leave, etc. Please know that the CDOT benefits team, that being Vanessa and myself, are active participants on the DPA Leave Administrators Committee, and as soon as we know more, you will know more. Okay? So, how's that for giving you something but not enough, right? All right. State wellness programs. Over the last few years, the state wellness program, that by participating in it, you can earn a $20 credit towards your state medical insurance premium, has been administered through MotivateMe via the Cigna website. MotivateMe will be sunsetting over the next year. So they will be transitioning away from MotivateMe. But you still have the opportunity between now and June 15th to go into MotivateMe on the Cigna website on or before June 15th and earn your 240 points to get the $20 credit starting July 1st for the entire 12 months of the next plan year. By the way, you can earn your points by participating in activities. You can do it by recording that you got an annual physical, an eye exam, a dental checkup, a flu shot, oh my gosh, a mammogram, another cancer screening test. There are a number of ways that you can earn your points. It's really easy to hit 240. So I would encourage everybody to go in to MotivateMe. Whether you are with Cigna or Kaiser, you still go through the Cigna website. If you're a Kaiser participant, you self-report your points. I am, and it was easy. I did it in about 10 minutes. If you are with Cigna, many of the things you've already have done may have already recorded points for you. So make sure that you go in between now and June 15th, earn your points, get your $20 a month. Don't leave money on the table. The state is rolling out, or has been rolling out, a new program called the State of Health. It is a no-cost mental and physical health improvement program. Participants in this program also receive the $20 a month credit towards medical premiums. Now, if you're getting it through MotivateMe, you can't get another 20 through State of Health. It's one or the other, but it's a second option for getting that money. You can choose between 3 pathways. There's intensive, supported, or self-directed. Self-directed is still being finalized. Watch for more details to come as this program continues to expand and improve. Okay. There is a wonderful resource out there. It is the 23-24 Benefit Guide. It is available on the state website. It is available in English and Spanish. You can print it out, you can bookmark it, you can go through it and learn everything you need to know and memorize it. But it's great information. It has all of the details on all of the benefits and what you need for the next year. As far as the benefits that we have, as usual, we do have 6 medical plan options through Cigna and Kaiser. This is just a chart of the Cigna medical plan comparisons. Shows you the 3 plans, the high deductible, the copay basic, and the copay plus. And it shows you what your basic costs are under each of those plans. Then we have, with Cigna, there are some additional benefits, if you will, or programs that are available. Those include Everside Health. That is a primary provider option that can reduce your cost and increase the coverage and the service that you get. There is a travel reimbursement program that if you actually travel a certain distance outside of your home area to get medical treatment, you can get reimbursed for travel expenses, thereby reducing your out-of-pocket cost. There is Included Health. This used to be called Grand Rounds. They are a second opinion survey service that is, again, no cost to you. And there's a Healthcare Blue Book where you can earn cash back when you select one of their preferred facilities. I do know that a coworker told me that she recently got a $25 cash back reward for having just gone to her regular facility to get a regular service because it was on the fair priced facility preferred provider list. So just some other options for services and coverages when you have the Cigna insurance. This is a Kaiser medical plan comparison. I do encourage you to make note that the annual deductibles have changed for each of the plans, something that you may want to make note of when you are looking at your plan elections for the coming year. Okay? Then we have the vision plans. No change to the vision plans, not even any increase in services. It's the same basic services and the same cost. Then we have the dental plans. Again, no changes to any of the dental plans, with the exception that the, I believe it is the Basic Plus plan did have a slight price increase. Nothing substantial. It went down last year. It went up this year, a little fluctuation. All the same services, all the same coverages. Also, the state is continuing to offer free dental for any children up to the age of 5. And you no longer have to re-enroll your kids when the oldest one turns 5. It's now become automatic in the system. We are continuing to provide the Right Start for Kids program at no cost to employees. This program provides that for any of your kids covered under dental under the age of 13, there's 100% coverage not only for preventative, but also for basic and major services. So if they have to have a filling, a root canal, something of that nature, with the exception of orthodontia, you will not pay anything, not even the copay, or not even the deductible for those services. Also keep in mind that all of our plans are prevention first, which means the cost of your cleanings and your regular x-rays don't impact or reduce the maximum benefit you have for other services throughout the year. Okay, health savings accounts. Nothing is really changing here with the exception that the IRS has raised the maximum contribution amount. This year, starting July 1st, employees will be able to contribute a total of $38.50. Keep in mind that when you are for individual coverage and $77.50 for family, keep in mind that when you are enrolling for HSA contributions and Benefit Solver, you are receiving a $60 per month contribution by the state of Colorado. So Benefit Solver is smarter than you and I, and it actually deducts that $720, the $60 a month times 12 is $720 for the year. It deducts that $720 the state contributes from your contribution limit of $38.50, and it will allow you to contribute $31.30. That way you don't inadvertently contribute more than the IRS allows and get in trouble. A couple of things to remember about health savings accounts. Number one, in order to be eligible for it, you do have to be enrolled in a high deductible health plan. You also cannot have coverage under anybody else under a copay plan, Medicare, or TRICARE. And if you have, if you're in the high deductible health plan and you have an HSA, you cannot have a general purpose flexible spending account. You can have a limited purpose, and we'll go into more detail on that in just a moment. And you also cannot have received VA benefits within the past 3 months. You want to make sure in an HSA that you do keep your receipts, because it may be the IRS who comes back and asks for those receipts later to verify that any money you used out of your health savings account was used for eligible expenses. And you do have to enroll for the HSA program to receive the state's contribution. So in Benefit Solver, when you sign up for the high deductible health plan, you will then have the option to also enroll in the HSA program. If you do, we will set up the Optum Bank account for you. You don't have to do that. And the state will start contributing the $60 per month. But if you don't enroll for the HSA program, you're not going to get the $60 a month. So make sure that you enroll for both of those. Okay? Flexible spending accounts, they will continue to be administered by WEX. FSAs allow employees to use pre-tax dollars for eligible expenses for both health care and dependent care. The maximums are not going up. With regard to the healthcare FSAs, there's a general purpose. This is intended for those employees who don't have a health savings account, and the money in your FSA can be used for medical, dental, and vision expenses. Or there is a limited purpose FSA. This is intended for employees who do have an HSA, and the limited purpose FSA can only be used for dental and vision expenses. Then dependent care FSAs for dependent care daycare expenses. Keep in mind that FSAs are generally use it or lose it. That means the money you put in during a plan year has to be used during that plan year or it's forfeited. The one exception to this, and that is true of dependent care FSAs. However, there is a rollover option that the healthcare FSAs have. For this plan year, if you have up to $570 left in your healthcare FSA, that money will roll over and you can use it for next year's expenses. Starting July 1st, that rollover amount will increase from $570 to $620. You want to make sure that you have enough expenses to cover the amount that you're putting into your FSA, because any unused dollars for dependent care are forfeited, and any unused amounts over the rollover amount are forfeited. Again, keep your receipts. You can pay your expenses with your FSA debit card. You can do it at the provider, or you can submit paper forms if you pay those bills from another source. The debit cards are generally provided by WEX at the time you enroll or when the cards expire. So if you use all of your money in your FSA during the course of the year, don't throw the card away, because you'll want that the next year when you re-enroll for that. And remember, FSAs are the only benefit that you have to re-enroll in every year in order to continue your coverage. Okay? Optional life. The state is continuing to provide the basic life insurance at no cost to all eligible employees. You continue to have optional life, we provide the basic coverage. You have optional employee, spouse, and dependent life available to you. You can make changes to these during open enrollment. And this year, like last year, the guarantee issue amount for employee optional life is $150,000. That went up last year. Last year, employees had an opportunity to increase their life insurance without EOI, and you have that same opportunity this year. So if you currently have optional employee life less than $150,000 in coverage, you can request an increase in that optional employee life, increments of $10,000 to $50,000 up to the maximum of $150,000 without having to go through medical underwriting. You can request coverage over $150,000, but it will be subject to carrier approval. Dependent life insurance can only be elected during open enrollment when you're a new hire or when you're adding a new dependent. If you don't have dependent life insurance, but you do have optional employee life, it's something to think about for 50 cents or $1 a month. Any other increases in employee or spouse life are subject to carrier approval, but they can be done at any time during the year because life insurance is a post-tax deduction. Short-term and long-term disability, no changes to these benefits, the same things that they've always been. Short-term is provided to you at no cost by the state of Colorado. Long-term disability is an optional benefit for which you pay. More information on all of those on the website, on the DPA website. And if no other questions have come in?
No questions.
No questions. I'm now going to toss the baton to Vanessa Kniff, our benefits administrator, and she is actually going to take you through navigating Benefit Solver. We know many employees are very visual. We want to make sure that you know what to look for when you go into Benefit Solver so that you can do your transaction correctly.
Thanks, Sean. Hi, everybody. I'm Vanessa Kniff, and I'm going to walk us through a little bit of information on navigating Benefit Solver. So when you first go into Benefit Solver, do not register as a new user if you've been in there before. If you're a new employee, you will have to register as a new user. But if you've been in there and you've forgotten your password, down below you can see you can just click Forgot the Password. Things to remember is you have 3 times to try to get into Benefit Solver before it locks you out. Unfortunately, if you get locked out, you'll have to send us an email for us to help you get unlocked. But just remember that your password and your username is case sensitive. Once you get into Benefit Solver, you're going to see up in the top left-hand corner, it shows this one because it's today, 18 days left for open enrollment. If you're a new hire, you're going to see another banner that gives you the dates for your new hire enrollment. One really important thing Sean mentioned before, when you get into Benefit Solver, if you only want to look at what your benefits are, I've circled the benefit summary here in red. Just click on that benefit summary and it'll actually pull up a PDF for you to look at your benefits. Please do not start an open enrollment transaction unless you are going to make changes. Then the next screen you're going to come into is it's going to show you what enrollments you have. So this one that I have here is for a new hire. So if you're a new hire, it's going to show you step 1. As a new hire, you need to do a new hire enrollment, and then it'll throw you back in there to do the open enrollment. Make sure as a new hire, you do the new hire enrollment first and then the open enrollment. If you're not a new hire, all you're going to see is just an open enrollment transaction. So then when you go in through your next screens, it's going to walk you through to add dependents. If you don't want to, you can skip this screen, but if you do want to, you would click the button to add new dependent. It'll go down a list and you'll put their name and their birth date and their social security number and all of that, and it'll walk you through to get to the next screen. Again, if you don't want to add a new dependent, you don't have to do anything here. One other thing about dependents, you cannot delete a dependent. They can become inactive, and you cannot change a dependent on that screen, this screen that we were at. So let's say if you had Sky Bridges was your spouse, you cannot go in there and change your spouse. If you have a new spouse, you need to add them as a new dependent, and then on your old spouse, you would have to do a transaction as a divorce to get them out of there. Then the next screen, if you don't want to add dependents, it's going to come up with how would you like to enroll. So we have an option in here that's my choice that it will recommend for you. It'll go through the plans. You'll answer a few questions and it'll tell which plans might be the best for you. Or you can click I know what I want if you already know what benefits you want to do. Or if you want to keep the same plans, you can just click that and then start enrollment. Once you get into each item, the medical, dental, vision, it'll all have a separate area for each one of them. One of the big questions we always get is for the post-tax and the pre-tax. Post-tax elections are generally beneficial for those who have PARA service credits prior to July 1 of 2019, or if you are 3 to 5 years before retiring. Pre-tax will have a larger paycheck for you, more take-home pay. But if you do want to change to post-tax, these are the screens that you do it. When you get to medical, you would just hit edit, and in the top screen, it says the deductions. There's a drop-down for post-tax or pre-tax. Then you have to go through the dental and the vision. Each individual benefit, you have to tell it if you want it post-tax or pre-tax. And then when adding dependents, you will have to go through, again, like I said, each one. You must click on their name to add them to those benefits. So if you added a dependent in the beginning, you have to walk through medical to add them, dental to add them, and then vision to add them. Or if you do not want to add them to dental and vision, say you just want medical, then you would not check them in the vision screen. One thing we try to remind people too is if you add dependents or you change, that you might want to go to the very bottom of Benefit Solver and and take a look at your beneficiaries. We suggest this time of year for you to check your beneficiaries anyway to make sure that everybody that you want to be beneficiaries is included in there, and this is the screen that you can do it in. Okay, and after you make your benefit selections, it's going to walk you through to review. So you're not done yet. You just want to make sure that you're going to review all your benefit selections, and it'll bring up a list and it'll show, just go through line by line, make sure it's everything that you want. And so you will have to have benefit verification or dependent verification documents. You will have to submit those if you're adding dependents. If your dependents, spouse and children, have been verified before, you do not need to re-include those. It's only if you're adding a dependent. And just so you know, when it gets to the end, it's going to pop up this box that says dependent verification is required. And you do have until June 1st for documentation to be turned in. And then you're going to go to the next screen and you're going to just continue. You're still reviewing your transaction. And I just wanted to note that it's going to say pending verification, which is okay. And then you go back to change any of the areas. Once you pull it up, there's an edit button to the right, and you can click to edit that if you want to make any changes. And then once you get to the end, it's still going through all the elections, and it'll show the cost for each one of those. One thing to remember is long-term disability will not show a cost for you. That's because it's based on your age and your salary. And in Benefit Solver, we do not have salary information. So that's going to be show at 0. And you can get that cost off of the DPA website or in the benefit guides. Make sure when you get to the bottom and you see your monthly and everything's approved, you want to click approve here. You're not done yet. You're going to go through another screen. It's going to remind you that you need verification documents sent. You're going to click next. And then you're going to read. You're going to get a confirmation, or you're going to get the amount again, and you need to click agree. And then once you do all that, you're going to get a confirmation in the top right corner. I don't have one in this because I didn't complete this transaction, but it will provide you with a confirmation number, and you need to just write that down that you did go through your open enrollment. Okay, so the transactions are not completed until you receive that confirmation number. If you get out before you hit that agree and approve, it's going to put that transaction in progress, and we're going to send you an email that says, please go back in and finish your transaction. And you might get information from Benefit Solver, or you might get information from us. And again, your dependent verification docs are due on June 2nd. If you are adding a dependent and you cannot get those documentations to us by June 2nd, those dependents cannot be covered, and we will not be able to approve them. That's it.
No questions came in.
Great. Thank you, everybody.
So we want to thank everybody for joining us today. If you are a CDOT employee and you have questions, again, please reach out to Vanessa and I at dot_benefits@state.co.us. If you are an employee with another state agency who joined us today, we encourage you to reach out to your benefit administrator with your questions. If you have questions that are personal in nature, we did have, by the way, 2 or 3 emails come in during the course of the webcast that are more personal in nature, so we will be responding to those employees individually after the webcast with answers to their questions. But any questions, send it to the shared box. Documents, send it to the shared box. Again, open enrollment started Tuesday, and it will go through May 1st. So I want to thank everybody for joining us today. Thank you, gentlemen, for running our OIT today. We appreciate your expertise. We hope everybody has a great day and has a chance to enjoy the beautiful weather that we're having in Colorado right now. Thank you.
20-second delay, so we
Okay.
just gotta wait a little bit.
1 second. I'll just stand here and smile. You want me to dance or? Okay. Thank you.